Some new insight now into the CDC's guidance about getting students back into the classrooms. Some of those guidelines reinforce appropriate hygiene and social distancing practices, repurpose unused school spaces, develop a plan for if a student or staff member tests positive, and educate families on how to monitor for symptoms at home. Joining me now is Arnie Duncan, the former Secretary of Education in the Obama administration. Maxie Hollingsworth is a teacher at Red Elementary School in Houston, and Dr. Anita Gupta is an assistant professor at Johns Hopkins University School of Medicine. Quite a dynamic trio here. Let's get into this. Maxie, I'll go to you first. I'm curious what you make of these new guidelines and the push for in-person learning just a few weeks from now. What are your concerns?
Well, I've talked to many of my fellow teachers and school bus drivers and workers, all of whom have expressed concern about our ability to do this to reopen safely. What we need is a time to plan. We need sufficient resources, none of which we have right now. And so my concern is going back into the classroom with families that we serve with varying levels of health literacy and also varying health habits. And we can see, looking at social media, being out in the community, that people are not currently following those guidelines. And asking us to reopen schools right now does not make the best sense.
So, Mr. Secretary, I'll go to you now here. Are you surprised that the CDC issued new guidelines and put more emphasis on reopening classrooms? I mean, is the debate around schools now a political football?
Well, supposedly their new guidance was actually heavily edited by the White House. And so they're trying to have it both ways. So they're saying things that don't make sense. But if you read into the document, it says school districts should use discretion and not open where cases are surging. Unfortunately, just in the past month, cases have more than doubled across the country. We now have over 73,000 cases a day. Just 1 month ago, we had 36,000. Things are going the wrong way. 38 states, things are going up. We simply have not done what we needed to do in March, in April, in May, in June, and now in July, so that we could have a good, clean opening for our children, for our teachers, for our parents as we go into August and September.
Dr. Gupta, to you now, from a medical perspective, are these new guidelines enough to guarantee students and faculty stay safe?
Well, thank you, first of all, for having me here today. First and foremost, I want to say that, look, I'm in the state of California, and we have had a very forward-thinking governor that has made it very clear that we will be doing distance learning. And that, as far as the CDC guidelines, I believe that they are putting children and families as a paramount concern. But what is so critical to understand is that we don't have the data on what can potentially happen in children after they are potentially in school for many months during a major pandemic. We are in unprecedented times, and certainly we know the benefits of being in school, but what are the answers to these questions? And as a parent and as a physician, I certainly want to understand them clearly before I send my kids back.
Yeah, for sure. The CDC laid out some of the reasons behind this push for in-person learning, emphasizing the critical roles that schools play in providing a safe, supportive learning environment for students, also providing services that help mitigate health disparities and address mental health. And the agency says it will be harmful for students if those are not available. Arnie, what do you make of that, and how do you address those issues if students aren't in school?
Well, let's break this down very carefully. And obviously, everybody, every parent, every teacher, every child would rather go back to school than stay at home. But you have to do that in a safe manner. So throughout this pandemic, the delivery of food, districts have been feeding tens of millions of meals every single day to children, their families, to the broader community. I've been doing a weekly call for months with people doing just amazing work there. Students' mental and emotional health. Schools have transitioned to telehealth. Social workers, counselors, teachers checking on students sometimes on a daily basis. We want to open schools. We need to open schools, but we need to keep them open. And this is a time where I think we have to have real empathy. Our students are watching us. Are we going to pay attention to science? Are we going to listen to the concerns of teachers and parents? We have to do this the right way. If we can just go gradually, slowly, start with younger children, start with the children most in need, start with the children who are most vulnerable, make sure we maintain that physical distancing. And the biggest thing we have to do is beat down the number of cases in our communities. If those cases continue to rise, it gives teachers and superintendents and principals no choice but to close back down. The goal here is not to reopen schools. The goal is to keep schools open for children, for their parents, for teachers, for the community.
Maxie, building off of what the Secretary has just said, with regard to bringing kids back into the classroom, what are going to be the biggest challenges for that? I mean, young children, do they listen to their teachers? Will they stop and wash their hands? Will they socially distant? Do they need to wear masks? I mean, how is that going to work? What are the biggest challenges you're concerned about with that?
Well, I teach pre-K through fifth grade students at my school.
You're exactly the one to
in my school. And I can tell you exactly that before this pandemic, I had trouble keeping my students' fingers out of their nose and out of their mouths. And I can't see how we're going to be able to implement that now during a pandemic with social distancing, with 22 to 25 students in a classroom wearing masks. And again, we do provide critical structure for the schools, for the communities, but we need the correct funding, we need adequate planning, we need all those resources in order to do this with a tiered approach. I don't think we can just come back and open in September or August and pretend as if nothing is going on.
Dr. Gupta, with regard to masks and these young kids, what do we know for sure about coronavirus transmission among children, both the young, those that Maxie would teach, and those in the teenage years in high school, for example, or junior high at least? And how does that impact how we should be sending students back to the classroom?
Very, very important question. We don't know much, and this is the challenge here. What we do know is that there was one study done in South Korea, and that did show conflicting data. We know that children younger than 10 transmit the virus to others much less than adults. But the same study showed that the ages between 10 and 19 can spread the virus as least as well as adults. So this is the challenge. How are we going to address these? And potentially, as we heard, we certainly have to do this in a tiered manner. We have to potentially provide online and potentially hybrid tools to these students, and also answer these unanswered questions of accountability, funding. How will these schools determine these policies when no framework exists? I mean, we certainly want to protect our educators and our students.
I want to ask all three of you the same question. I'll begin with you, Dr. Gupta, because you said you're a mom. Would you send your kids back to school?
We have no choice. In the state of California, the decision was very clear that we will be doing distance virtual learning at this point. But I strongly believe that in-school learning is paramount. It is for the best for children, and eventually we would love to send our children back.
Maxie?
I'm also a parent. I'm the parent of a child who is in a high-risk category. She has asthma. I would not be comfortable sending her to school at this time, and I wouldn't be comfortable teaching in school because I would expose myself and also her. I'm comfortable with our district's decision right now to start off with a virtual learning plan and then assess from there to determine how we're going to move forward. That's what I would be comfortable with.
Yeah, see what's so extraordinary between the two of you. You see the difference. It just each individual has to make that decision, what is best for them. So I'll let you, Secretary Duncan, weigh in the final word on this. How about you?
So my son is in high school. He'll probably go back to a hybrid situation in school 1 week or 2 weeks, doing it virtual 1 week or 2 weeks. I'm comfortable with that to start with. My daughter will go to college, will go to a physical university, but all the classes will be online. But let me complicate this. We can't just think about what's right for our children. My son might like to go to school 3 days a week, 4 days a week, 5 days a week. There may be another child in his class who has to go to school because their parents are essential workers, or as a high schooler, they might have to stay home because they do a better job on the virtual environment, and we may have to open up our high schools for our pre-K and first to second grade students or our middle school students. So this can't be where we as parents are selfish. We have to see our common humanity. We have to look out not just for our own children, but for our neighbors' children. We're all in this together. Yeah. This was a natural disaster that became a man-made catastrophe. We have to solve this together at the local level.
Look, as very eloquently Maxie described there, this is not a one-size-fits-all solution. Lots of challenges ahead. Dr. Anita Gupta, Maxie Hollingsworth, and Secretary Arnie Duncan, guys, thank you all so much for the conversation.